So, welcome to Wondermous. My name is Merikay Hunt, and I am your podcast host featuring leadership journeys from amazing people in healthcare. And today I have Mario Singleton from Greensboro, North Carolina. Mario, why don't you share a little bit about with our audience who you are and what your current role is?
Mario Singleton, originally from Charlotte, but I've been in Greensboro probably for like the last 36 years. I am the current practice administrator for Anesthesiology Consultants of North Carolina. That's a mouthful, so we say ACNC for short.
Good. Awesome. And Mario, you and I met in the Greensboro Medical Group Managers Association. And why don't you share a little bit about the history of your career journey?
So, I actually got started in the healthcare in 2002. Out of college, I had a degree in business administration, concentration in business management, and I went into transportation truck. And after about 7 years, I had a conversation with the people who to my left and right who had been there about 30 years. And I just said to myself, I can't see myself in this situation for 30 years. And
Mm.
I have a servant's heart. So um I had at my church, I was over a step team. And yeah, yeah, I had a young lady who was on my step team, whose mother worked at the hospital and said that they were looking for some transporters in the radiology department. So I applied, and of course, she gave me a reference, and actually, that's how my journey started. I started out 2002 as a transporter in radiology
Wow.
department.
Talk about stepping stones. I love that. Like a true stepping stone. And servant's heart. Tell me more a little bit about that, Mario, and why you feel like that's made an impact for you.
So, my dad always taught me, it's always better to serve others than to be served. So I kind of grew up with that throughout my life. Especially, in sports, remaining humble, working hard, grinding. And over time that just kind of developed. I'm one of 10.
Wow.
So
Oh
um
my goodness.
yeah, my parents both have gone home to be with the Lord, but they had 5 girls, 5 boys. I'm number 8. So everybody had to serve, everybody had to do their part. My mom made sure all of the men know how to wash their clothes, know how to cook, and not have to depend on somebody hand and foot to to nurture them or take care of them when they got older. So that kind of developed, and even through my church, I'm always willing to serve.
Oh, I think that's awesome. All right. Well, I've said this to you before in person, but you are one of the sharpest dressed people I've ever met in my entire career.
Well, I will say I am my dad's child. So yeah,
So he was a sharp dresser too.
he was. Yeah.
Oh, that's awesome. And, one of the other things that really inspired me when we were getting to know each other in Greensboro at some of the medical group managers meeting was you had shared about some leadership coaching programs that were taking place. Tell me a little bit more about that.
So at Cone Hill, they wanted to develop a culture of accountability and shift. So a group called Insignium came in and um, the leadership chose about 23 people out of 10,000 to lead this culture transformation, because they say in the corporate world you could change the culture in a year, but in healthcare it takes about 5 years. So we
Wow.
all had we always had to submit a written application as to why we wanted to be what they call breakthrough masters. So these individuals will spend at least 2 to 3, maybe 5 hours a month with a personal coach and as a group, just getting coached and drilled on how to bring about culture transformation. So in 20, I want to say around 2011 to 2013, I kind of went on that journey.
Okay.
And that process, they would incorporate other subsets of the breakthrough master journey, like high performance leader, which means, you had to go through high performance leader. You had to pick a project and you had to fully develop that project from beginning to end, and you got critiqued on it. And even for a year, you had a personal coach with that particular organization so that you can help develop your leadership skills within the department that you were working. And at the time, I was the director of administration and operation of services at ACNC Hospital, which was a small hospital. But our responsibility as relates to when we would go out and begin to coach within the system, it could be any department within Commonwealth.
Sure, sure. And let's highlight the message that you shared. It can take 1 year in a corporation to shift a culture. Why is it taking 5 in healthcare? Help me understand that.
I think it was just because of one, how healthcare moves. A lot of people think it moves fast, but it doesn't. It moves really slow. And you have so many different specialties, so many different employees, so many different departments that you have to get, to transform. So I highlight this story. One we was having this one session and in Winston-Salem at the Grayland, and we had all of our key leaders, and Tim Rice was the leader at Cone Health, he was the CEO. And after we did a survey, um the leaders at Insigniam told us that in your region you're great, but compared to other hospitals of your size, you don't stack up that way. And oh man, if you could see the faces of the leaders in
Wow.
that meeting, they were indignant, like, how dare you say that about Cone Health? However, Tim had an epiphany that night. And he said, you know what? The first 2 or 3 years of my presidency, I've been a CEO, I've been playing defense. It's time for me to go on offense. And
Oh,
at that, when he realized,
it's Mario, when you said that.
yeah. So when he came to that realization, it shifted the entire mindset of that leadership team. And
Mm-hmm.
instead of every other board meeting, you know, he was fearful of being fired. He was like, I'm gonna drive this. And he started driving it. And that's when Cone Health culture really started to shift. He gave us the permission to become an accountable organization, especially among leadership. And wow, what a change that Cone Health started to make in the 2 to 3 years that we were in the Breakthrough Master Program.
Well, and this is a business principle that I have believed in for the majority of my career. Culture transformation has to start at the top. And I made a commitment, this was probably about 10 years ago. I said, I'm not working with a medical practice or a hospital or a dental practice unless the docs are participating, because I can go in and make change at different levels of the organization, but who's going to help encourage, support, reinforce if the leaders don't even know what we're trying to do? So I am so excited to hear that was a catalyst moment for him, and to really drive the change, but be the leader and walk the talk. So when you look at your career professional walk, what's one of the biggest challenges that you feel like you've overcome?
Um, I would say, particularly being like one of the few minorities that's already always in the room.
Hmm.
Um, the beginning of my career, that kind of it made me a little bit uncomfortable, a little bit intimidated. Um, but I like I shared before, I'm a man of faith, and the more that I read what God said about me, the more it's beginning.
Hmm.
And um, I just started to let my work speak for himself until people started, really saying, "Yeah, you belong at the table." And
Hmm.
and I appreciated that, and I always come to the table with a spirit of humility, um, not arrogance. Um, I will always tell people, don't let my quietness um come across as a sign of timidity. I'm like a sponge. I
Right,
like to
right.
listen and discern, you know, before I speak. And if I don't really have anything to say, I'm not gonna say something just to feel like I needed to have something to say to be recognized. That's just not how I operate. So um over time I got comfortable in my own skin. I knew that was an expectation, but I didn't let that limit me in, driving competition and driving excellence.
Well, and I think that was a quality that my dad, who's a periodontist, possessed. He was not the extrovert. He was a listener, but when he spoke, people listened. And I think that was one of his gifts is, really connecting with people and relating. And when you look at sort of key mentors or leaders that you admired during your tenure, who are some of those people that really helped shape who you are as a leader?
I would say um at the time I would say my my pastor, who pastored the church for like 37 years, which was kind of unheard of. But he was so well rounded and skilled in so many different areas just outside of, being a pastor. He had an engineering degree, an industrial engineering degree by trade. And I would also say, I mentioned Tim Rice. I probably learned more about healthcare spending my rotation as an administrative fellow with Tim Rice um, in 1 week than I probably learned in my career. Just
Wow.
about the, just about the humility, um, about it, not the privilege about it. Like he was the CEO, but if you would call his office, he would answer the phone. He wouldn't even let his secretary answer the phone. And just
Love that.
like, yeah, things about like emails. If he saw that you had more than 100 emails, and he would just, that would be a pet peeve of him. Like if he sent you an email, he expected you return it in 24 to 48 hours. But if you got like 9,000 emails, he would always highlight how are you spending your time. So I learned, I learned a lot. And then Mickey Foster gave me my first job out of the fellowship when I went to ACNC. And he said he chose me because he thought that I was a leader of people and I was relational and I could connect. So he gave me an opportunity and then our opportunity, I got the ability to really thrive. So I would highlight those three people.
Well, that's awesome. And so explain a little bit about your role now and what you're doing for your group.
So again, I'm the practice administrator for anesthesiology, ACNC. And we are private practice and we primarily are the anesthesia group for Cone Health for their major sites. And in my role, this was something totally new. I've worked with physicians in the past in oncology, neurology, cardiology. This group is anesthesiology is a little different in terms of how they deal. And in this role, it's particularly different because I have to know everything. I have to know contracting. I have to know HR. I have to know malpractice. I have to know the operations. I have to know the administration. So, which is great because I'm one that like to have my hands in the cookie jar. I like to kind of uh, keep things moving and spicy and stuff. So it's given me a tremendous opportunity to grow in those different areas and learn because I always want to be a continuous learner. I'll never want to be to that point where I feel like I've arrived. So this has been an extremely rewarding experience for me as a practice lead.
Oh, that's fantastic. And what are some of the key initiatives that you all are focused on for 2026 and 2027?
So it's growth. So we talked a little bit about culture. I worked under at least four, almost five CEOs at Cone Health. And one of the key elements in terms of performance drivers and revenue generation is the operating. So my practice has been chosen to lead a transformation in the operating room and the anesthesia care at Cone Health, which if you can master that, um, you can have huge financial rewards as well as um, work-life balance for all of the staff. It's a huge task. Every CEO that's come through Cone have to try to do it. It takes a lot of collaboration, a lot of elbow grease working, meeting with surgeons because they really drive your revenue. So that's something that we really tried to focus on, not just for the strength of the organization, really patient. Patient should always be at the center of the care. And if you driving great patient care, those other things will start to fall into place.
Sure. So is the goal to like decrease time in the OR, be aware of materials, improve communications so that the procedure flow is more streamlined? Are those some of the things that they're focusing on?
Yeah, so we know that healthcare costs continues to get more expensive each year. So
Mhm.
how do you streamline your ORs? How do you streamline the type of products that you're using? You don't have 6 different products that do the same thing. How do you begin to work with the different specialties in the community to make sure that patients are getting down and getting surgery in a timely manner, and then that their aftercare is just as great as the surgeons or the specialty groups that are working on them. So it's a collaborative effort. We got a committee that hears everything, and I continue to use my skills as a breakthrough master, sometimes being not necessarily a practice manager, but a consultant in terms of
Sure.
how you have these conversations, how you get that buy-in order to be able to drive that efficiency.
Well, it reminds me of one of the initiatives we were working at our hospital where I was director of patient and family experience. We wanted to improve throughput in the emergency department, and that involved several different departments. So we created this patient experience team, if you will, similar, it sounds like, to the committee that you all have. And I think
Mhm.
one of the key things whenever you're launching new initiatives, it's got to have that stickiness factor. So if we are going to make a change, it's got to be, real, and it's got to have a structure and stick. So when you think about kind of your leadership, growth and development, what do you think has been one of your greatest learning lessons?
I would say always being a continuous learner.
Mm, mm.
Um, every conversation, every boardroom meeting, every conference that you go to, there's always some nuggets that are being dropped that you can take and implement in your leadership style. The generations change, so I can't lead 20 years ago like I lead now because I'm dealing with a different generation. So you have to be flexible, you have to be adaptable, and at the end of the day, you just got to be authentic, and you got to want to see individuals grow. So I would say, yeah, just always remaining humble and always being willing to learn, have that ability to want to learn to get to the next level.
Or at lifelong learning, right? So many people in healthcare are dedicated to that, and I think it's a tremendous quality. So as we come in for a landing here, Mario, if you were going to talk to your younger self and give your younger self some words of wisdom or encouragement, what would you say?
Um, Allow yourself some grace,
Mm,
as Lord will put it, sufficient grace, because you're going to make mistakes. You're not going to have all of the answers. Um, However, be accountable. Stay authentic to yourself and in your abilities, and know that you belong. But most of all, just extend yourself some grace.
give yourself some grace. Thank you, Mario. This has been a true pleasure sharing and learning from you. And again, thank you for tuning in to another episode of Wondermous. My name is Merikay Hunt, founder of Coach MK Companies. You can visit me at coachmkay.com. Please like, subscribe, and share our channel with others that want to learn, grow, and lead to take their career to the next level. Blessings to you, and make every day count.